Hello, dear friends. I welcome you all to this video series on Ramadan. We have seen about the introduction of the Ramadan fasting. Now, let us start this video series by starting the effects of Ramadan fasting on human body. So, today we are going to see about the effect of Ramadan fasting on body weight, blood pressure, blood lipids, and heart. So, let us start this video with the effects of the Ramadan fasting on our body. So first is the body weight. There is loss of weight and body mass index during Ramadan fasting. So we all know that as the intake of our food and the fluids is reduced tremendously during daytime and during night time also. So it leads to the loss of body weight, mostly in middle-aged adults because their BMI is more and their metabolic rate is also more. So it is more significant in men as compared to women. So the mechanism by which there is loss of weight is there is intake in the reduction in energy intake, increased daily energy consumption with continued routine activities. So we consume energy for doing our activities, but intake is less. Decreased body fluids and consumption of food and drink at night. So we usually eat during night and during daytime we fast. So there's a lower food absorption during night time compared to the daytime. So these are all the mechanisms by which we lost the body weight. There are some factors which will increase your loss of weight more depending on your initial BMI, your age, fasting duration. We have seen that on an average, the fasting duration ranges from 11 hours to 22 hours. So definitely it will have the reduction effect on our body weight. Then reduced calorie intake, low fats, carbohydrates, more protein, fruits and vegetables. So this is very important. If you go on taking very high fat diet and high carbohydrate diet, there will be no loss of weight. So we need to do that. We should take more protein, fruits and vegetables during night time and avoid the fat and carbohydrate. And frequency and timing of eating. What we observe that after iftar, people they start eating like anything. They just go on eating and eating. So that is not a good habit. That doesn't serve the meaning of the Ramadan fasting. So you need to take the fluids and the semi-solids in average quantity after iftar also. And you need to do the continued physical activity and your sleeping habit. So if you are sleeping continuously for 24 hours, there will be no loss of weight. You need to continue your regular routine activity. Ramadan fasting does not stop you from doing any type of work. I have heard so many people saying that Ramadan is going on. How can we do such activity? Ramzan never says that you should not do a particular type of work. So we need to continue our routine work as when we were doing when Ramadan was not there. We should not stop any work just because of Ramadan. So these are all the influencing factors which will lead to loss of weight when you follow all these factors. Now, second effect is on our body blood pressure. So Ramadan fasting has a beneficial effect on blood pressure irrespective of the body weight. So it helps in reducing both systolic and diastolic blood pressure in a person with hypertension. It also supports anti-hypertensive therapy in further reducing blood pressure. So fasting has adjunct effect with the anti-hypertensive therapy. It does not lead to excess reduction of blood pressure below normal levels. I have never seen any person who developed hypertension during Ramadan fasting. Some people may develop the hypoglycemic attack, but not the hypotension. The mechanism of reducing blood pressure by Ramadan fasting is the hunger sensation triggered during fasting prevents catecholamine release, which causes decreased blood flow in the veins, causing reduced cardiac output and decreased arterial pressure. Fasting causes metabolic switch, in which the body switches to use ketones for energy instead of glucose after 8 to 12 hours of fasting, leading to drop of insulin levels, which in turn reduces sympathetic nervous system activity and thus reduce blood pressure. High blood pressure is also caused by lack of elasticity of vascular wall and endothelial dysfunction. Fasting helps in maintaining the elasticity of vascular wall and thus preventing endothelial dysfunction. and it also leads to decreased fluid intake. So these are all the mechanisms by which it reduces our blood pressure. Now, third part is the effect of Ramadan fasting on blood lipid levels. So Ramadan fasting leads to significant reduction in lower density lipoprotein, which is a very bad cholesterol, and it causes significant increase in high density lipoprotein, which is a good cholesterol. So these lipid changes may persist for about 1 month after Ramadan. So if we continue the fasting and if we continue the same dietary pattern which we followed during Ramadan, it may lead to reduction in LDL and increase in the HDL. So Ramadan fasting helps in maintaining elasticity of arterial wall and thus prevents endothelial dysfunction. So this also helps in preventing or improving atherosclerosis, which is an important cause of heart attack. So, and also prohibition of smoking during fasting also helps improve cardiovascular health. So in turn, in healthy individuals without cardiovascular disease, fasting can help in preventing cardiovascular disease. In patients with cardiovascular disease, it can help in preventing complications such as heart attack. So Ramadan fasting leads to the healthy heart and happy heart. So this is the beneficial effect of Ramadan fasting on the heart. So fasting is not about diet of burning calories, but burning of pride, ego, and sin. So Ramadan intention and fasting intention is to burn our pride, ego, and sin. Ramadan is not a temporary increase of religious practice, but it is a glimpse of what we are capable of doing every day. So it is the 1 month training which is given to the Muslims during Ramadan fasting that they should follow same pattern of lifestyle in remaining 11 months of the year. So this is all about the effect of Ramadan fasting on body weight, blood pressure, and blood lipids. Thank you very much. Please subscribe my channel, like and share. Thank you.